Welcome, everybody. I think we're just waiting for a few more to join, but nice to see you all. Okay, well, good afternoon, everybody. Let's make a start. Really great to see you all, and welcome to this HIC EPR network webinar with our colleagues from Hill Dickinson. I'm Hadley Stoller, Chief Exec of HIC, and I'm thrilled to be joined today by Lucy, one of the legal directors at Hill Dickinson, and Jamie, a partner from the team as well. Obviously, as Colleen says in the chat, Colleen from the HIC team, feel free to post questions and comments, etc. As we are moving through, and it'd be good to know who is on the call as well. So please put that in the chat too, so we know who's here. We do have a couple of slides that we want to go through, and then we'll have some kind of open discussion and dialogue. Obviously, if there's any questions or anything you'd like to add, please also put that into the chat too. If I ask Colleen maybe to move us on to the next slide, that would be great. But I don't know, Jamie, Tracy, do you just want to say hello as well?
Yeah, good morning, everybody. Great to be here. I'm Jamie Foster, partner at Hill Dickinson.
And I'm Lucy Probert. I'm a legal director in the team.
So great to have you both. So just some housekeeping. So if you could just mute your audio and videos, that would be great. As I said before, questions, etc., in the in the chat would be great. Obviously, we're recording the session, and within the next day or so, we'll aim to send those recordings over to you. And obviously, we'll be sharing the slides as well. So thank you for that. If we can move on, that'd be great. So just a little bit about, we've skipped a slide. Yeah, perfect. So thanks, Colleen. So Healthcare Innovation Consortium, HIC, for those of you that don't know us, we're an independent consultancy agency. We specialise in digital health transformation. We're partnered with a number of healthcare organisations, both from within the NHS and from the supplier community, to deliver services around discovery, implementation and evaluation. And obviously part of what we do is bring communities and networks together through members, including Hill Dickinson and our EPR network, which we're obviously hosting this session today. We provide readiness and maturity assessments, procurement guidance. We work on options appraisals and, as I said before, implementation, utilisation and benefits to kind of achieve measurable success. So the idea is that we aim to cover that whole life cycle of concept to implementation and evaluation and all in between. And you can see some of the logos there of the kind of organisations we work with, community interest companies, organisations in Wales and others across the NHS and other parts of the UK. So that's a little bit about us, and you can see a nice picture there from one of our EPR summits earlier this year, which I'll talk a little bit more about later on. So we'll just go to the next slide, Colleen. Thank you. Are you able to move that slide, Colleen? It's not moving. Oh, there we go. So obviously, in terms of bringing this EPR community together, we kind of host and run the UK's only EPR network, based for healthcare leaders both within the NHS, but also from the vendor and supplier community to kind of come together, collaborate, and share learnings. And on the back of that, we also host kind of regional and national events, which through our summit kind of series, which are designed to really bring that thinking and that kind of those learnings together. We had our England-based EPR summit earlier this year, and we are coming to Wales on the 18th of November. There'll be a QR code at the end of this kind of webinar for you to scan if you're interested in coming to that. And then we have our main kind of annual event again in England in February next year. So it'd be great to see as many of you there as possible. And we run those summits with our partner group Convensis, who I'm not sure they're on the call today, but yeah, we work with them in partnership too. So that's a little bit about us. I'll hand over to Jamie and the team from Hill Dickinson just to talk a little bit about who they are, what they do, and some of the kind of insights that they want to share with us as part of this webinar today. So Jamie, over to you.
Great, thank you, Hadley. Great to be here, everybody. So we are an international law firm. We're a member of the EPR network and delighted to be so, and have worked with Hadley and team over the years on various projects. We certainly are interested in and invested in the EPR sector. So Hill Dickinson, as I said, is an international firm, but we have a very large healthcare practice, and that advises everybody from tiny health tech startups through to listed tech suppliers, all the way through to NHS hospital trusts and ICBs who are buying technology, and other national bodies and regulators. So we see technology procurement and contracting from every angle. We act, as I say, for the buyers and for the sellers. And I think that gives us a unique perspective on the kind of pitfalls and issues that come up again and again on these procurements. Now, obviously, we're talking about EPR procurement today, but lots of the lessons that come from EPR procurements and contracting apply across technology as a whole in the NHS. And I think this is particularly relevant given the current government's focus on adopting more technology going forward. So yeah, delighted to share some of our learnings. Everything we're going to talk about here today is very practical and suggests some of the things that we've seen from across the country on these kind of procurements. And yeah, delighted to be joined by Lucy in our procurement team, who is a core part of the team advising on these matters. And I think the next slide, that's office locations, the UK ones, particularly relevant to today. And I think the next slide, we don't need to dwell on that too much. That's just a legal disclaimer for when these slides are circulated afterwards. So yeah, I think that's it. Hadley, back to you, I think.
Yeah, thanks, Jamie. Thanks so much. So, just wanted to talk a little bit about some of the work that we've kind of done in this area, and in particular some of the kind of market analysis that we've looked at. And in a recent poll that we had out on LinkedIn, we found that 57% of people told us that there were unexpected costs or delays, which you can see there were some of the biggest challenges around EPR projects, and obviously, as you can see there, misaligned procurement was at kind of 29%. So that may not be a shock to you, Jamie, because obviously you referenced there some of those experiences that you've had. But I guess does it match what you're seeing with clients? Is that, and Lucy too, is that something that you find in terms of things that are just unexpected that people kind of didn't foresee and didn't kind of plan as part of that, procurement and implementation kind of journey?
Yeah, so I think there's quite a bit sort of to unpack in that. There is, I think, a lot, and we're going to come on to this shortly about kind of common kind of early stage mistakes in EPR procurement. But a lot of it is if you can get your procurement process right in the first place, particularly the planning and design work for that, then I think that helps to mitigate a lot of the risk that you see later on, particularly around kind of there's kind of steps that you where there is that sort of ability for delay. So if we look at kind of common early mistakes and where we can sort of mitigate those delays and those costs, I think the first thing is actually managing stakeholder engagement when you are kind of designing your requirements as an authority, to make that understood, to make it comprehensive enough so that if you've got different sites, if you've got different client groups, if you've got different needs, those are properly kind of understood. But the key to it, I think a lot of the time, is actually making sure that stakeholder engagement is properly managed and manageable. So, for example, you often find procurement processes that become kind of overly complex because people try and actually there's too many cooks. It's about trying to get that wider engagement in the beginning so that you fully kind of comprehensively scope the requirement, but also then when it comes to doing things like having subject matter evaluation, you're keeping the evaluation panel manageable, you're keeping the questions focused, you're not having too many questions in your procurement process, because that all helps you to manage that procurement timeline. I think sort of built into that is also understanding actually procurement obligations early on. So part of that kind of design role in avoiding cost and delay is to make sure that people understand their procurement obligations. It helps if, first of all, you understand which bit of legislation you're under, but more importantly, kind of, again, understanding everybody's responsibilities in pre-market engagement, making sure that you're engaging transparently, fairly, that you're documenting those discussions. So for the purpose then that when you actually hit the procurement phase, you are cited on things like conflicts of interest, that you're aware that everyone has the same amount of information. And that's actually how you get the best out of it, so that when you then publish your specification, the market is cited on it. And that's one of the key kind of ways to kind of mitigate the risk of delay. Jamie, is there anything you would add to that?
No, I think that's right. It's planning properly at the outset, understanding the procurement obligations, and although that sounds, there's clearly a very legal element to that, it's very common in our experience that people are not clear on procurement and what the obligations are. Clearly, that's where we're here to help, but making sure the whole team, not just one or two people, understand all of that, the better.
Yeah. Sorry, Lucy, were you going to?
No, I was just going to say, and speaking of the wider team, I think that's another element that can cause delay, actually, is working out what team you need in terms of your kind of core function when you're procuring EPR systems. So, you want technical support, you want legal support, you might want financial support. So it's kind of early engagement with all of those technical advisors and making sure that they, again, understand, communicate the need, then that can help to kind of smooth the procurement journey as well.
Well, my question, actually, my follow-on question from what you described there was going to be, who should those stakeholders be, and often who aren't those stakeholders, if that makes sense. Who in your experience isn't involved, and just very conscious of some of the people that have introduced themselves on the chat. We've got somebody called Tony Thornburn, who's come from one of the Genomic Medicine Service Alliances, but he's also a patient and public involvement chair. So, I was just going to ask the question, who do you think those stakeholders need to be? I know you've already alluded to some of them, and what role, if any, do you think that patient voice has in that procurement, exercise?
Yeah, I mean, I think that's it, isn't it? Because there's two elements to an EPR system. There is the kind of technical data protection, all of that kind of very technical element, but then there's also the user experience. So and it's making sure that both of those are kind of represented, but equally kind of framing then the requirements and then the questions that we ask in the procurement that then scored to give you what is the best quality solution. That all has to be quite finely balanced. So I think it's making sure you're clear at the beginning what your objectives are, what your priorities are, and making sure that you kind of your criteria, your reward criteria, your kind of procurement process is actually designed to draw those out. So I think in that respect, you can't kind of underestimate the importance of those pre-market activities. I think it's helpful. I think people often think of procurement as just that kind of bit where you're actually procuring the contract. You know, you're running a competitive process or something like that. And it's not. You need to think of procurement more holistically about, first of all, it's about understanding need, translating that need into a set of requirements that are communicable to the market, allowing the market to come in with their expertise and kind of inform and update those requirements, and then putting it out in a contract form for which you then have a formal tender process. So I think it's kind of, again, in order to avoid delay, the idea is that you use that in the best way possible to shape your requirements and your process so that things go smoother at the point that you put it out. If you don't do that, the danger is, of course, that you get prolonged things like prolonged clarification stages, that you get into there's a lot more risk goes into it because there's a lot more uncertainty. So that the sooner that you can kind of build that certainty in for the market, the better it is, and actually the better quality bid you get, because you get a bid that's much less caveated, that has far fewer assumptions in, and that actually smooths the valuation, because then there's like a common, you're able to compare, you know, it can compare easily the solution against those requirements where they're well articulated.
Yeah, and I'm really thrilled that Colleen put this your slide back up, actually, because I was going to ask you, kind of with all that said, you know, do you think there's a kind of single most common early stage mistake that you see in EPR procurement? Because obviously, I mean, in our experience, that there are often, you know, really kind of robust stakeholder groups that do come round the table and do help to design those specifications and you know, take trust through that kind of process. But yeah, these mistakes and, well, maybe not mistakes, but maybe mistakes, you know, these kind of mistakes, these considerations, you know, are often repeated. So it was just kind of what you think maybe the top, you know, kind of mistake that you see kind of is, and whether that is the thing that maybe then influences everything else, you know, when some of those kind of areas fall down.
Yeah, I mean, I think I know I've said it already, but kind of that robust engagement with the market to help shape your requirements. There are things that you can put out to test, to see what the market's reaction is to them, to understand how that might shape, you know, have a consequence on your affordability or anything like that. So the clearer you can be earlier on about those requirements, and actually about the constraints as well. So for example, if you have an affordability threshold, the sooner and clearer that that's communicated to the market, the better grasp that you can have about actually what is kind of within the realm of the possible. And it's avoiding kind of over complexity as well, because as soon as you know, with all those stakeholders that you've just mentioned, Hadi, the danger is that, as I say, things become too complex, too unmanageable, and soon you've got an evaluation process that you've communicated to everyone, that everyone's prepared their bids on, but actually is not well understood by the bidders, it's not well understood by the evaluators, and that's why you introduce procurement risk. And the other thing to avoid there is obviously that final point, which is also making sure that things that don't have unintended consequences. So if you put draconian requirements on, so you must do this or you will be excluded, you must score a minimum score of X or you will be excluded. If you haven't tested that, the risk is you go to the market and everybody fails, and then where do you go from there? So I think it's that.
Yeah, no, great. Last question, just on this particular topic. Maybe Jamie, if I can bring you in, kind of in your experience, then what just on that kind of theme really that Lucy was describing, what contract clause would you say is most essential, but too often kind of neglected in these EPR contracts? You know, is there one that kind of stands out in your mind?
There is. Just before I answer that, just to
Yeah.
pick up on something Lucy was talking about, I think in the engagement piece, it's really important to recognize the subtleties of this. So, you know, it is often the case that a particular part of the country is looking at convergence, and you have national, regional bodies who are keen to have all of the same EPR providers across a number of trusts. You know, you need to think carefully about how you approach market engagement and how you approach procurement law when that is the case. You know, when you think you know who you want, there is still clearly a very important role for the pre-market engagement process in that. In fact, arguably even more important. So it's not always the case that there is a one single set process and way to do things. You need to clearly adapt to the realities of your position if you're a buyer. I just wanted to add that. In answer to your question, by far the most common problem we see once contracts have been signed is implementation issues. So the supplier might, you know, that there may be delays in relation to implementation, and there may be good reasons on the vendor side as to why that is the case. Sometimes the buyers hold their hands up and say, look, we haven't been able to commit the resources we wanted to commit, so we're at fault as well. So the single most important contract clause is the clause around milestones and how delay payments potentially fit into that if milestones are not hit. And again, it's about being flexible and making sure that milestones and delay payments that arise if milestones aren't hit by the vendor are realistic and reflect what is actually going to happen once you've moved into the implementation stage from contract signing. So I'd say the single most important clause we see, you know, pre and post contract signing is around the milestones and the delay payments in implementation.
Yeah, it's really interesting. And before we move on to the next area, actually, there's just some comments in the chat. One from Penny, who's actually our EPR network chair, is kind of echoing exactly that, Jamie, saying that procurement and business cases processes often only consider the period up to go live, especially when resources are decided. The common pitfall is to not consider the post go live period, and the workforce needs to stabilize and optimize the system. Building organisational capabilities often miss, so training and sustaining knowledge. And also a comment from Stephen from NHS England that just says that the Frontline Digitisation Programme works with trusts to assist with the development of EPR business cases and related procurements. And they recommend the use of the Cabinet Office endorsed frameworks and other kind of, you know, for the procurement of EPRs and other clinical solutions. So, yeah, echoing, you know, what you're saying there. So that's great. So, you know, kind of moving on to the next kind of theme, I guess, around managing expectations around procurement and the importance of building time in for complexity around this. I think Colleen is going to post in the chat a question for you guys to respond to, so please do that, just around if you've ever built in extra time for this. But, you know, if procurement timelines are, you know, inevitably really complex, where do you see organisations kind of wasting the most time, and how do you think that can be avoided?
So I think that there's two kind of elements, I think, to that. The first of all is kind of, you know, I think I've probably touched on this already, but again, if you can avoid sort of prolonged clarification stages when you have issued your contract and your procurement documents, I think, you know, the more transparent you can be, the more that reduces the scope for that delay at that point. Because obviously, if you're communicating additional information, or you are changing certain requirements because you kind of are actually getting the feedback from the market at the point that you put that kind of formal, you start your tender process, then actually that can, you've got to give people then time, in fairness, to update those bids, to rehash information that they perhaps already, if they're already in flight in preparing those bids. And I don't think anyone should underestimate how much bidders actually put into those bids, then that's a real issue in terms of adding delay, particularly if you're on a tight procurement timescale. Perhaps you've got an expiring contract. So I think it all helps to mitigate risk if you can be as upfront in your planning. And I think it is just tight project management from a kind of operational point of view. We all know that within the NHS there are periods of where operational capacity is reduced because there are things like winter pressures, because there are all kinds of kind of operational challenges. So where you've then got relying on stakeholders, or you're relying on technical teams to kind of evaluate, to put into evaluation and moderation, just making sure that we're aware of that and building that in. I mean, we've just come out of summer. I can't tell you how many procurements that you could sort of come out, because actually quite everybody from the moderation teams on holiday in August. So it's just making sure that you kind of recognize the realities and being realistic about how we all operate, really.
Yeah, no, very good. And just to circle back to the beginning, there is a poll in the chat. If people could just respond to that would be great. So, Jamie, I might come to you next and just kind of ask what you think. What's the most effective way for procurement leads to kind of forecast negotiation and kind of board sign off of timelines? Because obviously, clearly, what Lucy's describing there, perhaps needs some more thought at that point. So, what do you feel is the most effective way for procurement leads to do that?
I think, it's clearly all about planning and, knowing the set piece approvals and engagements that are needed and factoring those in as early as possible. We're often asked for kind of legal assurance, legal opinions, board briefings, at a delayed time when they could have been put in place earlier. So I think it is really just about, as I said earlier, it's really just about planning and recognizing that there are lots of different people involved in these projects, and they all need to feed into that process. So it's a role really for the PMO to make sure that there is, properly thought through planning process.
And what do you think those kind of legal review stages, are, that the procurement team should realistically kind of anticipate, even under those tight timelines, because that's what it feels like you're describing, isn't it? About different kind of stages and reviews that are needed, but broadly, what do you think they are?
Well, I think there's the initial input, and being involved from the outset to help with planning. As Lucy said earlier, the earlier we as a legal team are involved and are a core part of the team, the better. That doesn't mean we need to be continually involved at the same level of intensity throughout the program, but involvement early on is really important. When you're working with framework terms and conditions, so for example, through the frontline digitization program, you'll be using an LPP, Clinical Digital Health Solutions framework contract. There are terms and conditions there. That's really helpful. That's a good starting point. But that doesn't mean that there isn't a role for lawyers and us to be involved, because they need tailoring. And a really, really essential part of that is recognizing that vendors will always come to the table with their view of what needs to change in those framework terms and conditions. The day when a vendor says, "Yep, happy to sign off on those framework terms, no changes required," well, it'll never happen. And understandably so, because vendors have different needs and different approaches and different solutions, and the market evolves, the tech evolves, and the tech doesn't always exactly fit into the framework terms, however good the framework terms are. So there's the second stage for us, I think, is being involved in anticipating and helping, negotiate framework terms into something that fits the solution. And then the final is more around the kind of sign off as things develop through. So as things develop through the different procurement stages, we have a role in signing off and assuring legally things both on the procurement side and on the contracting side at each of those stages, right up to final board approvals.
Feels like there's a need for maybe a different and more kind of more involvement perhaps in that pre-market engagement, possibly with the supply community too, to understand and maybe try and foresee what some of those. I mean, obviously you're never going to be able to kind of factor everything in, and you won't necessarily know until you've awarded, for example, because the devil's in the detail at that point, right? But it feels like maybe at that pre-market engagement that maybe some of those conversations could be happening, which I'm not sure they necessarily do at that early stage. That's really helpful. I mean, you've maybe already answered this, but maybe to come to you, Lucy, too. One piece of advice to procurement leads about kind of pacing their process. If you had one piece of advice around trying to make sure all of that essential kind of engagement is done and all those kind of boxes are ticked, what would it be? Because we do have some procurement leads on the call, so I'm sure they'll be interested to hear that.
Well, I'm sure they probably know this already, but don't be pressured, I think, into adopting kind of any unrealistic timescales. The more pressure you put on that timeline, I think the more you introduce procurement risk, because things get missed, things get rushed. And I think also, just picking up on what Jamie said there, I think the other kind of top tip is, you will need to tailor those framework terms. You don't need to wait till you've completed pre-market engagement to do that. You can test some of those kind of project-specific stuff, project-specific contract terms, whether it's insurance, whether it's liability caps. You can test the tolerance for the market in that by having an idea of those at market engagement stage. So I would say, again, don't put the contract off till the outcome of pre-market engagement is done. Look at the requirements, make sure that you're feeding it so that you turn it around so that you've got your requirement, you've got your contract, and use that to be shaped by market engagement, not do the contract post-market engagement, if that makes sense. Because that's often the point we're brought in. And actually, I think it would be more helpful if you have a view on some of that before. Particularly since it's going to feed into things like, if you've got affordability thresholds or something like that, the market needs to account for.
Yeah, and I think Penny's point before is actually well made in this context too, in the sense that actually to try and future-proof that contract for when optimization is happening, because ultimately there will be a need. I mean, we know this from our experience. There are needs for product development, new features, configuration that needs to happen.
And even exit services, and even if you can forecast that as well, build that in, look at the contract as a whole at that point. I think that's definitely going to be right, Headley, I think.
Yeah, absolutely. So it's almost about so I think from what you're saying, Lucy, is don't rush it, which I think makes sense. Make sure it's well informed from that supplier voice as well as from stakeholders internally. But also as much as possible using, as Stephen, kind of told us about those kind of nationally kind of available resources, but make sure it's as future-proofed as possible for when that system develops over time, because some of these contracts are kind of 10 years, aren't they? In the whole, so that's a long time, isn't it? To just be focused on the initial go live, right? It's got to kind of have that holistic future view as well. I don't know, Jamie, if there's anything you want to add before we move on to our kind of next topic.
No, I think that's all right. That's all correct. Fully agree.
Yeah. And Stephen's just put actually in the chat just to finish this one off. So where NHS England provides central funding, which obviously can happen to procure EPR solutions, we require the submission of a supporting legal report as part of the FBC submission. The legal report needs to assess compliance with procurement regulations and the suitability/appropriateness of the final agreed T's and C's. So obviously that's another kind of stage in that process, particularly where national funding has been, sought, which I think is the case in a lot of instances. So that's great. So, that kind of takes us really nice, I guess, into some of the risks, because I guess even when those timelines are managed, stakeholders are on board, all that engagement has happened, risks can creep in, especially as that kind of, as you alluded to before, Jamie, that technology and kind of regulation, areas, evolve. So in terms of, I suppose, risk factors and some of those legal risks and challenges during procurement, looking ahead, what do you see as the kind of biggest legal risk in EPR procurement over the next kind of 3 to 5 years?
If I just kick off with one and then Lucy can add in. I mean, I think I touched on it before, the issue of convergence is a risk. I suppose you could widen that to policy generally. NHC and others rightly have a policy position on adoption of this really important technology. And it's not to say that you can't do things like convergence, but you just need to be careful about how you approach it from a procurement perspective. So I think that's one thing just to watch. The other is and Stephen may be able to help us on this, but what comes next in terms of the LPP framework ending as it does next year, what that means for frontline digitization funding and things like that. So both sort of policy points really, but we are in a market where those are important.
Yeah, no, 100%. Lucy, I don't know if you want to add anything to that.
No, I think as a procurement lawyer, I'd obviously say suboptimal procurement. But I think we probably banged on that enough. And I think the other one to bear in mind is also funding as well. Just understanding exactly what, if you have an impact on your procurement from delay, that can also affect the availability of funding. So I think it's worth just sort of like keeping an eye on that as well.
Yeah. I was interested that kind of neither of you spoke about things like kind of AI. I know that's the big buzzword, isn't it? But the role that could play is going to play. Recently the EPR network, and obviously you guys contributed to it. We published a white paper on AI and what it meant, within the EPR space, and just whether the technology in that sense will kind of move ahead so quickly and vastly in the next 3 to 5 years, whether that, has kind of implications from a legal perspective, and how you can future-proof technology that's obviously moving so quickly and so sophisticated, in such a sophisticated way. Do we not know what we don't know at this point on that front, where things are actually taking a much quicker kind of pace, really? So just
it's obviously a good question. I think the answer to it at the moment is that it's the case that the technology is obviously developing very quickly, but the law isn't. So the legal position at the moment is where it's been for some years. The key law that regulates AI, if you like, is data protection law. And if your EPR has some element of medical device built into it, then the rules around medical device regulation and what the MHRA regulates. So we don't have in the UK yet, as I'm sure everybody knows, anything equivalent to the EU AI Act. So the key thing at the moment, if you're buying AI or you're selling AI is to make sure that you're compliant with those existing data protection and medical device laws. I think the one area where we are seeing things moving very quickly is clearly cybersecurity and the way that cyber links into the data protection compliance. That's becoming more and more critical and important. And that's something that buying teams are scrutinizing rightly ever more carefully. Things are moving, but as yet the legal framework hasn't changed. So that's framework that everybody has to comply with.
So I was going to ask you kind of what specific kind of new risks are emerging, in this space, and it might not necessarily be AI, but perhaps on that topic in particular, it's the risk is that there is nothing else really for us to measure what good looks like against, other than what's kind of other countries are using, for example. Maybe that is just a risk in itself, right?
I think it's the uncertainty that it's adding into it, isn't it? I think as well, there are also things to consider, like where technology is moving that quickly and where people are adopting new systems. It's about making sure that you can sort of we're talking about patient records, so it's being able to access historical information, making sure that that data is still, if there's a new system developed or a new way of working developed, that's captured somehow and accessible to clinicians. That it's not. Yes, it's good to adopt all of the new technologies and the new developments, but it's also making sure that you've kind of got those legacy arrangements in place, so that and if you're forecasting a 10-year contract, yes, technological change is difficult to add into it, but you can mitigate some of those risks by contracting well, in terms of making sure that they are kind of outcome requirements, that you retain access, that those documents are available, that you continue to maintain historical systems and update, and all of the rest of it. But you know what I mean? It's sort of it's trying to legislate for what you can control.
It's an outcome. It's a future-proofed kind of outcomes-based model, which is a very different, isn't it? To say we recognise that AI, as an example, will play a significant part in EPRs in the next however many years, and maybe that is something that is kind of procured at a later date, for example, as part of the overall framework, right? So maybe that's, or overall contract. So maybe that's something different, a different way of kind of future-proofing these contracts moving forward. And actually, obviously, that's one end of the spectrum, Lucy. And I know you spoke before about exiting and having that kind of considered as well. What do you think kind of is overlooked in that sense? In terms of exit or termination risks that organisations might want to be aware of, because obviously, there may be ambitions that perhaps can't be met, or maybe the technology is so far advanced that it, the trust, for example, can't actually respond to that. So, that there might be on both sides very legitimate reasons, to exit. There's obviously other reasons too, but in terms of risks associated with that organisations should be aware of, what do you think they are?
I mean, I think it's good contract management as well. So, it's having an exit plan, sure, making sure it's, because, you have something when you get a supply, you'll negotiate an exit plan within however many, but it's also making sure making sure that that's actually done, and B, that there is a mechanism in place to keep that under review. So at every point that there is change introduced into the system, that someone has one eye on that exit plan. And then, if you have points of review, because quite often it gets neglected because you're so busy running the contract in life, that I think there's a risk that it gets forgotten about, and then at the point at which you then reach exit, you're kind of scrambling around, and it's a bit of there's then a disconnect between what the supplier believes it's required to do and what the authority needs it to do in order to get a safe transfer of systems. So I think it's making sure that there are clear requirements, that those requirements keep pace with the change that's going on, as you've said, during the life of the contract. And also the issue of pricing. If you can deal with some of those prices for exit services up front, then all the better. You may not be able to do, there's a limitation to which you can do that, but it's communicating that if you need to roll that contract on, that it's not kind of a sort of a fait accompli in terms of, well, we're required to uplift prices, etc. So I think it's just about making sure that they're kind of managing expectations and managing that relationship.
Yeah, no, 100%. Jamie, what red flags then do you think, kind of particularly in vendor supplier proposals, should kind of, or would immediately raise concerns about kind of legal or commercial risk? Obviously, maybe not having some of the things that Lucy's just described would be one, but do you think there are others?
Yeah, I think that's right. I think hidden costs is another one. Not, or maybe hidden is the wrong word, but Sometimes you see bids that are complex, have uncosted assumptions. It's difficult to work out what the true cost is. So I think that's something that buyers always need to look out for. I think another one is the supply chain. To the extent that vendors have supply chains, for example, involving cloud providers, sometimes major cloud providers, being clear about what risk those subcontractors are willing to accept is really important, because it may be that the vendor is saying yes to everything that the buyer is asking, but actually their supply chain is not willing to take the same risk, and then there is a potential problem. So we see that more and more, and obviously kind of looking at if you're looking at a 10-year contract, for example, then the change control mechanisms and what is likely to change over that time in terms of technology, pricing, all of those sort of things is important as well. So those are some of the common risks we see.
Yeah, and actually, again, Stephen from NHSC said that cost variation is a big issue, increased volumes of patients, transactions, etc. So kind of aligns with your thinking too. So we've got to 10 to 1. We're going to open up for a couple of questions, but I suppose just to recap, we've covered kind of 3 key areas there. So we've gone from kind of the early stages of that EPR around kind of processes, common pitfalls, and areas potentially where there's confusion at the beginning of the process, ensuring that more time is invested up front, not to rush the development of these specifications, utilizing the nationally available contracts and support that exists, but clearly future proofing is essential, but also contract management, which I think was a key point that you made, Lucy. It's not just about bringing this thing in, it's actually about maintaining it as well, which can also then lead on to some of those kind of outcome based components of a contract, whereby you don't know what you don't know now, but you know that these things are potentially coming, and to allow for that in the contract. And that complexity around procurement itself is really about making sure the right people are around the table, and that the right kind of solution is procured for the right need of that organisation. And that's where obviously supplier engagement all the way through, really, as much as possible, is really key. We spoke about some of those kind of frameworks and kind of, I suppose, legal frameworks that don't exist here currently, but are a good kind of baseline to kind of at least base some of that thinking on right now. And then obviously right now, just then talking about some of those risks and challenges. So cost variations, and kind of making sure that everything from the exciting stuff around AI and other kind of developments that might come in the next 3 to 5 years are accounted for, but also that contract and termination clause to make sure that it, in the need that you may have for that it's obviously taken time to think about that up front. So that's kind of broadly where we got to. Lots of complexity there. I don't envy you guys having to kind of work through all of that. It's really complicated stuff, isn't it? But so important to the foundations of what makes ultimately a really successful EPR in place. And I think it's often the area that is maybe forgotten. I mean, it's not forgotten in the sense that obviously procurement leads, like we've been discussing, are clearly very in tune with it, but as you're going through, it's often forgotten, but it shouldn't be. It should be part of weaved into the whole life cycle for these EPR deployments. So with that said, I don't know if you guys have got any kind of final thoughts, by the way. Feel free to kind of come in if you do, but whilst we're maybe doing that, if there are any questions from people in the audience, feel free to put them in the chat, and then we can hopefully have that discussion. There's one from Stephen, which I'll come to in a second, but I don't know, Jamie, Lucy, do you want to just kind of give your overall view?
I think we're optimistic people. We think that procurement law can be there to deliver value for money and quality solutions, and if you put the time in and as a buyer and do the planning and follow the rules, then the EPR procurement process need not be painful, and it can be relatively risk-free. We see plenty of procurements, EPR and other tech, that are procured without legal challenge or particular difficulties. So I think it's very doable. I would just touching on the comment Stephen's just put in the comment. I completely agree with. I completely agree with that. We see, unfortunately, perhaps we see a lot of requirements for our support during the implementation phase when things are not working out as everyone had intended. So I do agree with that. Implementation and then operation is the tricky bit. Just one final thought I would add is really, the key for EPR procurements and other tech is the exciting stuff about what could come next in terms of the technology in the next 10 years, and making sure you have a solution that allows that technology to be brought on board is essential. That's the exciting bit, really.
No, 100%. Lucy, any final thoughts on that as well?
No, I mean, I think a lot of it's been said, but I think again, it's remembering that procurement is more than just the stage up to award. It is that contract management. It's about trying to forecast in life, so that when you do hit that bumpy road on implementation, or you do hit that bumpy bit on exit, that there is at least something in the kind of arsenal to go fall back on.
Yeah, 100%. No, that's really good. Well, whilst others might be thinking of some questions, there's a final couple slides that I just want to present, if that's okay. I'm sure Colleen will share that in a second. Before I come on to that, and obviously I'll say it at the end as well, but just to say thank you to you guys. That's been really, really helpful and really, really insightful into some of these complexities. Obviously, as part of the EPR network, we have some other webinars coming up there. I won't read all of them, but you can see there that the next one's on the 30th of September. So that's got a focus on kind of business cases and procurement lessons for what's ahead. So if you would like to join us on that, we'd love to have you. And then there's that's with SI Squared, and then Ready Computing will also be having their webinar on the 16th of October, and there'll be others that follow too. So we look forward to those, and hope you can join us for those that are coming up. And then if we go to the next slide, I think it was just really to circle back round on some of the EHR, EPR summits that we are kind of hosting and running with our partner Convensis group. So the next one is coming up on the 18th of November. That's in Wales. We're coming to Cardiff to talk about kind of adapting EPRs and learning from the rest of the UK to kind of help to inform some of the thinking in that part of the world. And then the kind of annual England EPR summit will also be on the 11th of February. So if you'd like to join the waitlist for that and would like to attend, please scan that QR code. It would be great to have you join us there, and we're always open to people to come forward to be speakers and be part of our panels, etc. So if you'd like to join in any of those two that are upcoming, that would be great. So with that said, here are some of our contact details. It'd be great to hear from you if you want to reach out and ask anything. As I said at the beginning, we'll obviously share the recording, we'll share the slides. If you've got feedback on the webinar too, there's a QR code. We'd love to hear that. We've got a lot more webinars coming up from different members of the network. So if there's anything else you'd like to see or any feedback you'd like to give, we would really appreciate that. So just looking one more time in the chat, we're getting into some other things here around retiring legacy applications. We might not get onto that now, but we'll certainly try and respond to all of those comments and questions after the webinar as part of the post kind of webinar comms. So Jamie, Lucy, thank you very much for your time today. Thanks to all of you for joining. It's been great to have you. Look forward to seeing you at the future webinars and future summits that are coming up. Have a good rest of the day, and we look forward to seeing you all soon. Thank you very much.
Thanks, everyone.
Thanks, guys.
Thank you.
Take care.
Bye.